So hello and welcome to this month's episode of the Dentistry Gym. So in today's episode, we're going to be talking about acute lower back pain. Now, maybe you woke up in the morning and like, oh, my back really hurts today. You can't bend down, you can't move around. Maybe you have a tight band of pain across your lower back. So now, often when you have acute lower back pain, people think to themselves, oh, let me go and lie down. Let me not move. Let me protect the area. Now, this is wishful thinking in a way because it often does the opposite of what you want. It actually prolongs your pain and it prolongs your recovery. So movement is medicine here. Now, when you have any kind of inflammation or acute lower back pain, often when you don't move, fluid and muscle spasm just stay there, all right? The body wants to move. So when you move around, inflammation goes out, new blood comes in. And also when you do exercise, the body can produce endocannabinoids, which is your body's own drug cabinet. So those drugs that your body produces through exercise and movement are much more powerful than the most powerful opioids we have out there. So it's really important that you try to get moving as soon as possible, obviously within reason. And I'll teach you today how to discern whether it's too much movement or whether you're doing too much too soon, okay? Because there is a recovery period like any kind of injury. But oftentimes when you slowly reintroduce movement and exercise, you're gonna feel much better, much faster, okay? So now I'm gonna preface this with saying that if you have any sort of other symptoms that you're a bit worrying, things like shooting pain down your legs, problems with your bowel or bladder, nausea, vomiting, very intense pain, then please go and see your doctor or your physio and have them diagnose you and see what's going on, all right? Because there's often things out there that we think are just like acute lower back pain or just acute problem, but it could be something else, okay? And always use pain as a guide. I always like to use the 5 out of 10 rule, all right? If you have, say, a little bit of discomfort when you're exercising that's manageable and it doesn't make your pain worse or last much longer, then it's okay. So a 5 out of 10 pain that maybe lasts for no more than 5 or 10 minutes afterwards is usually okay, all right? But you know yourself the best, so just do as much as you can. Even if you have to do it quite frequently, maybe you can't do much, but you just do it multiple times in the day, that's often better than trying to do too much in one go, all right? So follow along for some tips today, in how to help yourself feel better faster. So the first thing you're gonna do, if you can, is try to get down on the floor or lay on your bed, all right? Moving will be difficult, so take it slow, try to breathe through it. And you're gonna try to lay flat on your back. Ideally on a harder surface is better, but if you can't do this laying on the floor, just lay on your bed, all right? So you're gonna go onto your lower back, onto your back like this. And what you're gonna do is laying in this position, you're gonna bring your knees up like that. You're gonna make a little fist and you're gonna place it onto the muscle in your lower back. And you can do this on both sides as well, all right? If you find that difficult, maybe because of your shoulder, grab a tennis ball or grab something that's relatively firm and you're gonna place it right on the muscle. You're not gonna place it on the spine, you're gonna place it on the side of your lower back where this meaty stuff is through here. All right? So once you've got your hand on there and your knees are bent, so now you're just gonna start to breathe. When you have acute lower back pain, your body is in a state of, not shock, but it's a state of protection, all right? It's scared. So we wanna try to relax the body because this is a period of stress. So how we're gonna do that is we're gonna take some nice, long, slow breaths and we're gonna try to slowly relax our back onto the fist or onto the tennis ball, all right? So take a few breaths in, laying on your back, in through your nose, hold at the top, and then as you breathe out, try to relax, okay? Take another breath in and out and relax. Good, keep going. And out, relax. So what you're trying to do is at that little hand, if you imagine this is the muscle, you're gonna try to imagine that your muscle is gonna start to sink into that fist or that ball, okay? Imagine the muscle's gonna swallow it up, so you're gonna try to sink. Imagine you got like a stone slab on top of you and it's pressing you down. I don't want you to try to push like this, but instead what you can do is just slowly sink yourself down. You often need to relax those muscles because you might feel they're quite rock solid, they're instead of spasm. So it's important you try to relax them, all right? So I'm gonna pop my hand on there again. And then as I breathe out, I'm trying to just relax. Imagine the muscles swallowing the fist of the ball. Okay, again, breathe and then relax. You can do this on both sides as well. Keep going, breathing. Trying to relax, just sinking in. and out. Good. Keep going. And out. And if you're in a lot of acute pain, I would suggest trying to stay here for at least 5 to 10 minutes, trying to breathe and relax, okay? The next step of what you're gonna do is you're gonna imagine that if you take your bicep through here and you just tense it like that, you squeeze it. I'm not moving my arm, but I'm squeezing the muscle like that. Try to do the same thing with your lower back. It can be very, very difficult, but you just try to imagine that you're gonna squeeze that muscle in your lower back. You're trying to squeeze that into the ball, okay? That's gonna create a pumping action that's gonna push out any inflammation that might be in the area. So as you breathe in, squeeze, breathe out, relax. Breathe in, squeeze, breathe out, relax. Breathe in, squeeze the muscle, and breathe out, relax. Breathe in, squeeze, breathe out, and relax. A few more times. Breathe in, squeeze, breathe out, relax. Good. Again, try to stay there for a period of time. Try to get your muscle to relax and your body to feel better. So the next thing we're going to work on is we're just going to go knees together and we're going to drop them down to the side and then go back the other way. You might feel this is really uncomfortable. That's okay. Just do what you can. Even if you could maybe only go that far, that's fine. Just spend a bit of time there. If you could go further, drop the knees right down. You're trying to keep your shoulders flat on the floor when you do this. Nice and gentle, just rocking side to side, okay? Remember the 5 out of 10 rule? You may start here, and then after a period of time, you'll notice you go here. The idea is you're trying to just encourage a little bit of movement, nice and gentle. That's good. Keep going, rocking side to side. Just introducing nice, gentle movements, keeping the shoulders flat. Not pushing too far, especially if you feel a lot of pain. Good. Okay. Next thing we're going to work on is we're going to try to do some extension and flexion. So extension and flexion, just tilting the pelvis. So you can see I'm going to extend my spine and then flex my spine. Extend and then flex. So imagine if you put your hands there again, you're going to press down into your hands and then you're going to lift your hands, lift your stomach, or you lift your lower back away from your hands, sorry. Then press down into your hands, lift your back away. Press down, lift up, press down, lift up. So I'll move my hands so you can see. Press down, lift up, press down, and then lift up. Good. So the next thing you're gonna do, you're gonna come up into this position onto all fours, all right? If you've been laying down for a while, you might feel a little bit stiff. So take your time, slowly getting up, roll onto your side, use your hands to push you up, okay? Don't sit straight up like that. Roll onto your side, use your hands to come sit up, maybe take a breather, because it might be quite difficult, all right? So you're gonna start in this position here. So from here, you can go onto your toes if you feel more comfortable. And then what you're gonna do is just gonna slowly rock back and let the lower back round, okay? Then come forward, let the lower back round. You might feel some intense pulling during this, that's okay. Remember the 5 out of 10 rule, a little bit of discomfort is okay, but not too much, okay? You do want to feel a bit of a stretch here, you do want to feel a bit of movement, so it might feel a bit uncomfortable. So you're going to start with your hands here. As you start to feel better, work your hands out a little bit further so that you're reaching back much further until you can reach all the way back like that, and then you're going to come forward, okay? So we're going to go for this 10 times. 1, 2, that's it. 3, 4, keep going. That's it, good. 5, 6, good, all the way up to 10. All right? So now, once you've done that a few times, you're just gonna now stay in this position and you're gonna allow your belly button to drop towards the floor. Okay, so you can see I'm letting my belly button drop. And then from here, I'm going to now push my belly button away from the floor, push up my lower back towards the ceiling. So belly button to the floor, push back towards the ceiling. Okay? Belly button to the floor. Push back. You can round the upper back as well. Belly button to the floor, chest up. Back to the ceiling. And just repeat that a few times. Some more. Good. Remember the 5 out of 10 rule? If you can, try to push a little bit more. Squeeze those abs. Good. Tense that lower back as you drop down. As you push your lower back to the ceiling, squeeze the abs. Really try and tuck the pelvis underneath. Hold for a few seconds. Drop down. Good. That's it. Okay, so now what you're gonna do, you can come into this position if you can. If you can't do this, you can sit in a chair, that's fine. So what you're just gonna do is you're just gonna drop your hand to the side, and then if you can, go onto your elbow. Drop your hand to the side, go onto your elbow. That's it. You're just gonna try and remember, just get gentle movement in, feeling a bit of a stretch on the side here. Nice and slow. You might feel one side wants to move and one side doesn't, that's fine. Just remember the 5 out of 10 rule. Good, keep going. Push your hand out a bit further if you can. So reach much further. Good, reach a little bit further. Good, keep going. Now we're gonna stay in this position for a little bit. It's kind of like a mini plank. And then come back, go to the left side, stay in that position for a little bit. Same thing, it's like a mini little plank. If you find that hard, you can just put your hands straight and then hold. Come back, other side, hold that position. Remember to breathe. That's it, good. So now once you've done that, come into a standing position, and we're just gonna try to introduce a little bit of flexion. Often when people have acute lower back pain, this is the most difficult thing to do. So just start gentle, all right? You're gonna place your hands onto your thighs. Now you can put your back up against the wall if that makes it easier. And all you're gonna do is you're just gonna run your hands down your thighs. So now, maybe some of you, it might be like this. That's all you can do, that's fine. You're just gonna slowly rock back like this. As you get better, try to go a little bit further. That's fine. Remember the 5 out of 10 rule? Some of you may only be able to do this. That's fine. Just try to do it multiple times in the day. Remember, when you have acute lower back pain, there is a time period where it's gonna hurt, so you don't wanna push too much, but doing a little bit of something will speed up your recovery. Often when you have acute lower back pain, it can take maybe a couple of days to fully recover. But instead of being a couple of days, it might take you a week or more if you don't move. So try to introduce movement slowly, use high frequency, low intensity. So you're doing a little bit of movement, taking a break, a little bit of movement, taking a break. That's gonna help you feel better faster without overdoing it, okay? We don't wanna push too hard. If you're feeling okay and you can push a bit further, then that's okay to go for it. Just remember the 5 out of 10 rule, okay? 5 out of 10 pain for no more than 5 or 10 minutes afterwards. So then do a couple more, reaching down, nice and slow. Breathing and relaxing, going as far as you can without too much discomfort. Good, a couple more times, nice and slow. Try to remember the reference point of how far you go. So if you're starting here and now all of a sudden the next day you're going here, that means you've gotten a bit better, which is good. Keep going, and then come back up. Now you're gonna place your hands in the small of your back. You're gonna lean backwards, nice and gentle. Lean back. Sometimes you might feel quite acute pinching pain through here. This is one I wouldn't recommend pushing through. All right, if you feel a bit of sort of stretching pain, that's fine, but you don't wanna be feeling like you're compressing onto the joints too much. So take this one a bit more gentle than the other ones. A little bit of discomfort again is okay, but not too much. Lean back as far as you can, sticking the tummy forward. Good. That's it. A couple more times. Good. Now, from here, oftentimes when people have acute lower back pain, you might be like this, you know, so you feel like you're shifted to one side. So what you're gonna do is you're gonna take your pelvis and you're gonna push it that way, okay? Push that way. It can help if you go near a wall and try to touch the wall. That's it, just shifting side to side, nice and gentle. You can use your hand here as a little bit of pressure. Good. Hand on the other side, pushing that way. That's it, keep going. Nice and slow. Just trying to get a little bit of movement in there. Good, now we're going to do circles. So if you can't get on the floor for the first couple of ones, then you can just start right here. That's fine. Remember, high frequency, low intensity is often the best when you have very, very acute lower back pain. So if you find that you're tired already, it's fine. Take a break, come back and do it again later. Rest, move, rest, move, rest, move. It's often the best. Rather than just purely resting or doing loads of exercise, you're going to be doing a combination of both of them. Good. That's it. So now doing these will often help you feel better much faster. Like I said, you want to take that high frequency, low intensity approach when you have very acute lower back pain. If your pain's not so acute, maybe this might be too easy for you. I have a few other videos on the Dentistry Gym about lower back pain. I'll link them up somewhere here and have a look at those ones instead, because this video is more for people with very, very intense back pain. You can always come back to this video and do them again. Maybe you might start with some of the easier stuff and then after a couple of days you have to work onto the harder stuff. That's fine. Just remember that if you start to get problems with the bowel or bladder, you know, numbness in the saddle area, pain down your legs, vomiting, nausea, that kind of stuff, always go and see your doctor and have them check it out, because it could be something a bit more serious. All right, you don't want to leave something like that just a chance. I've seen too many people who kind of just had lower back pain and thought, okay, let me just take painkillers and lie in bed for a couple of days. That's often the worst thing that you can do. Sometimes the pain is so severe that maybe you feel like you can't move, that's fine. If that's the case, try to maybe lie on your back with your knees elevated in a 90-degree position, so almost like you're sitting, and then you might find that a bit more comfortable. But it's often the key that movement helps you feel better much faster. But just take your time and slowly integrate that movement, all right? If you like this video, give it a thumbs up and subscribe, and look out for more Dentistry Gym content. And share this with someone if they have acute lower back pain. I'm sure it could help them. Thank you.